All right, welcome back to part two. We are talking about how to check a responsive person. So you're going to need to know what sample means and how to ask questions related to it. All right, so the mnemonic sample can help you remember what to ask the person or bystanders to get a better understanding of the situation and the nature of a person's illness or injury. So the S stands for signs and symptoms. So you're going to want to ask the person, what are you feeling? When did you start feeling this way? Do you have any pain? If so, where's the pain located? What does it feel like and how bad is it? A stands for allergies. You're going to want to ask the person, do you have any allergies? Have you ever had a life threatening allergic reaction in the past? If so, when and what to? Ask about their medications. Are you taking any prescription or over the counter meds? If so, what are the names of the medications and when did you last take them? P is pertinent medical history. So ask if they have any medical conditions. You're going to want to talk about the last food or drink that they had. So, when was the last time they had it, and what did they have, and how much? And then their events leading up to the incident, kind of asking what happened, seeing what they can tell you. Then you're going to want to tell the person what you're going to do before you begin doing anything. All right, so you're going to avoid asking the person to move if you think that they have a head, neck, or spinal injury, and you're going to avoid asking the person to move any body part where he or she is experiencing discomfort and pain. Then we're going to go into our head to toe check, which is done in a systemic way, one part of the body at a time, moving straight down the body from head to toe, and then checking the arms, head and neck, shoulders, chest, abdomen, hips, legs, and feet, arms, and hands. All right, so when you're checking each part of the body one at a time, you're going to want to look for things like how the skin looks and feels, bleeding, cuts, burns, bruising, and swelling, deformities, medical ID tags, and the ability to move a part of the body without feeling pain, discomfort, or dizziness. If the person is unable or unwilling to move a body part, call 911 or the designated emergency number. Help the person rest in a comfortable position. Keep the person from getting chilled or overheated. Reassure the person by telling the person that you will help and EMS personnel has been called. Give care consistent with your knowledge and training and continue to watch for changes in the person's condition. If the person has no apparent signs or symptoms of injury or illness, have the person rest in a comfortable position. Continue to watch them for any changes in that condition. All right, so we're going to see sample in motion here. All right. So that is checking a responsive person. For a child, we're just going to want to talk to the adult as well. All right. So what should you do if you think a person is unresponsive? You're going to shout using the person's name if you know it. If there's no response, tap the person's shoulder if it's an adult or a child, on the bottom of the foot if it is an infant. Again, checking for normal breathing, no longer than 5 to 10 seconds, and gasping is not normal breathing. It does not constitute as normal breathing. If the person responds by moving, moaning, or opening their eyes but is not fully awake, send someone to call 911 or get the designated emergency number and obtain the AED and first aid kit. You're going to want to proceed with gathering information from bystanders by using sample, conduct your head-to-toe check, and roll the person onto his or her side in the recovery position if the person does not appear to have any injuries. So this is the recovery position here. You're going to want to bend their legs to help give them some stability. Put one arm out and they're going to rest their head down on that arm. The recovery position should be also used if a person begins to vomit or if it's necessary to leave the person to call 911 by themselves. If the person does not respond and is not breathing, send someone to call 911. You want to get that emergency kit. Make sure the person is face up on a firm, flat surface, and you're going to begin CPR if they are unresponsive. All right, using the AED if one becomes available, and if you're trained to do so in these skills. All right, this would be your putting it all together scenario, which you have already done up to this point. So that is part 2. Your last secret word is going to be toolbox. There you go. Make sure you fill out the worksheet.